ClickStar is a reusable injection pen that's designed to make it easier for you to take insulin. In this video, we'll show you how to use ClickStar effectively and answer some key questions about everyday use. If you need to see something again, just replay that section. If you are not able to follow the instructions completely on your own, only use ClickStar if you have help from a person who is able to follow the instructions. ClickStar comes in two colors: gray with a small raised circle on the top, and blue with a slick injection button. The rest of this demonstration uses the gray ClickStar. First of all, let's look at how easy it is to use ClickStar. Then we'll go into each step in more detail. Take off the cap. Unscrew the insulin cartridge holder from the pen body. Check the label on your cartridge to make sure you have the right insulin. Then, insert the new cartridge into the cartridge holder and screw it firmly back onto the pen body. Check that your insulin looks correct and attach a new needle. Then, dial 2 units and perform a safety test. Check that the insulin comes out of the needle. Now dial your dose and inject as instructed by your healthcare professional. Keep the button pressed down for 10 seconds. Withdraw the needle from your skin. Remove the needle and put the cap back on the pen. Now, let's look in detail at the steps you should take at every injection. Step 1. Insert a new cartridge. First, pull off the pen cap and unscrew the insulin cartridge holder from the pen body. If there's an empty insulin cartridge, just remove it. Check the label on your cartridge to make sure you have the right insulin. Then, insert the new cartridge into the cartridge holder. Align the insulin cartridge holder straight with the pen body and use the cartridge holder to push the plunger back. Or you can push the plunger back with your finger. Screw the insulin cartridge holder firmly back onto the pen body until it clicks into place. The marks on the cartridge holder and the pen body must line up. If the marks are not aligned, unscrew the cartridge holder and try again. Step 2. Check your insulin. Always check the label on your cartridge to make sure you have the right insulin. Step 3. Attach the needle. Take a new needle and remove the protective seal. You should use a new sterile needle for each injection. This helps to prevent both contamination and blocked needles. Only use needles that are compatible for use with ClickStar. Then, line up the needle with the pen. Hold it straight while you attach it by screwing it on firmly or pushing it on, depending on the type of needle. Step 4. Perform a safety test. The safety test makes sure you get an accurate dose by checking that the pen and needle work properly before you do your injection and by removing air bubbles. Do this test before every injection. First, select a dose of 2 units by turning the dosage selector. Then, take off the outer needle cap and keep it. Take off the inner needle cap and discard it. Now, hold the pen with the needle pointing upwards and tap the insulin reservoir so that any air bubbles rise up towards the needle. Keeping the needle pointed upwards, press the injection button all the way in. Then, check that insulin comes out of the needle tip. If insulin doesn't come out of the tip, repeat the test until it does. You may have to perform it several times before insulin is seen. If still no insulin comes out, the needle may be blocked. Change the needle and try again. If no insulin comes out after changing the needle, check that the cartridge is properly inserted. Then, repeat the safety test. If still no insulin comes out, your cartridge may be damaged. Do not use this cartridge. Insert a new one. Step 5. Select your dose. Select your required dose. You can set doses in 1 unit steps up to a maximum of 80 units. If you go past your dose, you can dial back down. Step 6. Inject your dose. Now you are ready to inject your dose. You should follow your healthcare professional's advice on where to inject, how to use a different place for each injection, and on the injection technique to use. Insert the needle into the skin. Deliver the dose by pressing the injection button slowly all the way in. The numbers in the dose window will go back down to 0 as you inject. Keep the injection button pressed all the way in. Slowly count to 10 before you take the needle out of your skin in order for the full dose to be delivered. Step 7. Remove and discard the needle. You should remove the needle after each injection and store ClickStar without a needle attached. This helps to prevent contamination and infection, keeps air out of the cartridge, and stops the insulin from leaking. Put the outer needle cap back on the needle and use it to unscrew the needle from the pen. To avoid needle injuries, never replace the inner cap. Now dispose of the needle safely as instructed by your healthcare professional. Always put the cap back on the pen and store ClickStar safely until your next injection. Lastly, let's go through some common questions. How do I know if I have enough insulin for my dose? When you get towards the end of the insulin reservoir, there may not be enough insulin for your dose. If you can't turn it to the dose you want, don't force it. ClickStar stops you from selecting a dose greater than the amount of insulin left in the reservoir. In this example, there are only 20 units left in the ClickStar, so you can't dial any further. You can either inject what's left in this cartridge and complete your dose with a new cartridge, or you can use a new cartridge for your full dose. How do I store ClickStar? Keep ClickStar out of the reach and sight of children. Don't put ClickStar in the fridge. Store your insulin cartridges in the fridge between 2 and 8 degrees Celsius until you need them. Keep them in the outer carton. Don't let insulin freeze, as this would damage it. When you start a new cartridge, take it out of the fridge 1 to 2 hours before you need it, so it can warm up to room temperature before you inject. Once the insulin cartridge is inserted into the pen, both pen and insulin can be safely kept at room temperature for up to 28 days, as long as it is below 25 degrees Celsius. Don't put it back into cold storage, and don't leave it anywhere where it might overheat. After using the pen for 4 years, dispose of it safely as instructed by your healthcare provider. How to solve problems with the pen. First, try changing the needle and repeating the safety test. Blocked or bent needles often cause problems that are easily solved. ClickStar is for one person's use only. Don't share it with anyone else. You'll find detailed instructions in the package leaflet supplied with your ClickStar. Never use ClickStar if it is damaged, if the cartridge is damaged, or if you're not sure if it is working properly. ClickStar is designed to be used for up to 4 years. Always have a backup method handy for delivering your insulin, such as a U100 insulin syringe. And remember, if you have any additional questions about diabetes, insulin, or ClickStar, or to get a new ClickStar after 4 years use, you should contact your healthcare professional for advice, or call Sanofi Aventis.